Good day, everyone. This is Advanced Research Methods 2, and the topic given to us is Guidelines in Research Among Vulnerable Subjects. And it will be presented by Cagayan Applejoy and yours truly, Nieves Joshua. But before we proceed to the main topic, which is vulnerable subject, we must first understand what is research. So research, according to my slide, is defined as an undertaking intended to extend knowledge through a disciplined inquiry or systematic investigation. A determination that research is the intended purpose of the undertaking is the key for differentiating activities that require ethics review and those that do not. Systematic methodological scientific approach for basic facts around a certain problem in order to find solution based on these facts. Then we will now proceed to a brief historical background. Do you know World War II? In World War II, the scientist or the researcher in the Nazi is doing some unethical, no, not some, mostly unethical experiment to their participants, mostly the prisoners. Some of these are sewing twins, seawater torture, sterilization, freezing, and body transplant, and so on and so forth. So this experiment is conducted on inmates of Nazi concentration camps. So these are the unethical behavior or experiments that are doing in World War II. And because of that, as a result, the International Research Guidelines created this Nuremberg Code in 1947. This is the first international code in research ethics. The content of this is the voluntary consent is absolutely essential, restricting research with infants, children, developmentally challenged, and etc. The risk-benefit analysis essential to ethics review. Scientific soundness is important to ethics review. The first provision of the code requires that the voluntary informed consent of the human subject is absolutely essential. So there must be consent to the participant. They must know what is the research about, what are they doing, the benefits, the risk, and so on and so forth. The capacity to consent, freedom from coercion, comprehension of the risk and benefits involved, experiment to be conducted by the highest qualified person. Another international research guidelines are the Declaration of Helsinki, World Medical Association, Tuskegee Syphilis Study Alabama, Willowbrook Study New York, and the Belmont Report. Okay? In the Declaration of Helsinki, the well-being of the subject should take precedence over the interest of science and society. So the well-being of the subject or the human subject is above the research. Consent should be in writing. So there must be a proof, okay? And it must be in writing. Use caution if participant is defended relationship with the researcher. Limited use of placebo and greater access to benefit. So if you are participating in some research, there must be a benefit for that. Okay, in WMA or World Medical Association, respect for person, standard of care, proxy consent, and assent for vulnerable population. Here in the Philippines, we have I've searched 3 laws for ethical conduct of scientific research. These are the Animal Welfare Act of 1998, the Wildlife Resources Conservation and Protection Act of 2011, the Philippine National Health Research System Act of 2013. Scientists are duty-bound to follow strictly a personal code of conduct that is based on self-respect and consideration of welfare and other stakeholders of the environment. Scientists are forthright and honest in all their professional relationships. They do not allow bias, conflict of interest, or under influence of others to prevail over their professional judgments. They must maintain a required level of professionalism, professional knowledge, and as well as the skill to ensure that intended beneficiaries consistently receive competent and reliable professional advice and services. Scientists must also respect the confidentiality of the information that is obtained in their research investigation. They must not disclose any information to the third parties without proper and scientific specific authority. And finally, they must comply with the relevant laws and regulation of the land and avoid taking any action that discredit the scientific community. Remember, it must be ethical and it must follow the ethical review. Now we will now proceed to vulnerable. So, vulnerable person are those who are relatively or absolutely incapable of, incapable. It is an individual who lacks the ability to fully consent to participate in the study. As you develop your study, consider the needs of participants and be aware of issues that may arise regarding their ability to provide consent. Ultimately, the board will approve studies that demonstrate sensitivity to the participants. Needs to minimize inability to consent does not limit participation in the study, but instead requires that additional safeguards and consent procedure must be followed. We have, these are the 8 categories of vulnerability. The IRB SBS identifies 8 categories where the potential for vulnerability exists in research. First, we have the cognitive or communicative vulnerability. It occurs when any participant is unable to process, understand, appreciate, and reason to the consent documentation and or explanation either by mental limitation or language limitation. There are various degrees as how this may occur. For example, a participant may not be able to read a consent form because of illiteracy, low reading comprehension skills, and or not speaking the language in which form is written. If you are targeting a population where this is likely to occur, you need to provide a consent procedure that will accommodate the needs of your participants, either by translating the document, writing it in their lay language, or discussing the consent. Then, number 2, we have the institutional vulnerability. So, institutional vulnerability occurs when individuals are subjects to formal authority and whose consent may be coerced, either directly or indirectly. Example, the prisoners, the student-professor relationship, and or employer relationship. The role of the formal authority in the study will determine the level of perceived or real coercion in the study. The solution for this issue is often in the manner in which data are collected and consent is obtained. Using a third party to do so often eliminates any conflict of interest. However, in this case, the prisoner-specific rules are in place regarding their use. The differential vulnerability occurs when individuals informally subordinate to an authority figure. Example of this is the abuse victims, the doctor-patient relationship, the husband and wife relationship. These are the situations where one party may feel obligated to follow the advice of another. This situation required a sensitive recruitment and consent plan where participants have the opportunity to consent voluntarily. For the medical vulnerability, it occurs when individuals' medical state may cloud their ability to make decisions regarding participation in the study. The patient may see the research study as a miracle cure to the disease instead of a procedure that has no guarantee for result. Often presenting the study in an environment where the participant is able to understand the full meaning of the study, it will help them to alleviate any misunderstanding. For the economic vulnerability, it occurs when individuals' economic situation or status make them vulnerable. Uh, the pre-medical care and the payments issued by participating in the study, it is important that the payment offered will not encourage any individual to put themselves at greater risk. For our social vulnerability, it occurs when participants are at risk for discrimination based on race, gender, ethnicity, or even the age. Researcher may not offer the full explanation in the consent because they might feel that participant is not be able to comprehend it because of that person's social vulnerability. The participant may also be prone to feel discriminated against as well and may not participate as a result. For the legal vulnerability, it occurs when participants do not have any legal consent or who may be concerned that their consent could put them at risk for legal repercussions. For those who are unable to legally consent, it is important that you obtain consent from a legal representative. And in most cases, obtain assent from the individual. For those that are concerned about having their legal status compromised by the study, they should take steps to legally protect the participant. And lastly, the study vulnerability. It occurs when the participants are made vulnerable by the study. The study's design, generally, this category refers to the participants who are deceived during the study and or the nature of the study is not revealed to the participant. This can be alleviated by providing full consent and disclosure after the study is complete or whatever a participant withdraws from the study. So these are the 8 categories of vulnerability. For the next topic or the main topic, it will be presented by Apple Joy Cagayan. Thank you.
Good day, everyone. I am Apple J.D. Cagayan, a PhD Science student, and today I will be continuing the discussion made by Sir Joshua L. Neves, and we are still on the guidelines in research among vulnerable subjects. So we all know that in the early stages of our research, we need to decide on a population to study. So there are many different factors that may guide the selection of our study population. So these are your research aims and at the same time, the anticipated availability of your participants. So one important factor that you need to consider in your selection is whether the population is considered vulnerable population. So we defined vulnerable population a while ago that it is a group of people that requires greater protection against the potential risk or potential risk of participating into research. So these are individuals in vulnerable populations that have higher risk of negative outcomes as a result of participating in a research study. So these participants may have a reduced capacity or ability to give consent, or for other reasons, they may have special legal protections. And this time, I will be discussing who are the subjects or populations that are considered vulnerable in research. So let me present my screen. Okay, so the vulnerable subjects that I included here are the women, the pregnant women, the children, the mentally ill or the mentally handicapped persons, the elderly, the prisoners, and the educationally or economically disadvantaged. So let us first discuss women as a vulnerable subject or a vulnerable population in research. So in our society, women are regarded to have traditional roles, and that is being a mother and also the family's caregivers. So based from our history, men before can easily go out to look for a job opportunities, but women are likely to remain at home to care for their children and to their elderly family members. So this might be the reasons why women are considered vulnerable. So, but of course, in today's era, both genders are now given the same opportunities. So the uh, women in the reproductory age group are usually excluded in drug or vaccine studies where the possible effect on fetus are known. So the women that we are referring here are those women who are on their reproductory age. So these are the women that are 15 years old to 49 years old, and these are the women that are ready to bear a child. So for example, a group of researchers would want to identify the easiest way to conceive a child. Okay, so the target participants here are the girls or the women. So if given the consent to participate, they may give them clinical trials or injections or vitamins or any medications that in the future might be harmful to the possible formed fetus. So as justice to women, their health conditions should be addressed while they are involved in research. So the types of research that benefit women directly include obstetrics and gynecology, sexually transmitted infections, vitamin studies, and etc. So let's give here an example. So based from what I read, in the sub-Saharan Africa, there is what they call feminization of HIV or AIDS or HIV and AIDS. So this means that in the region, HIV rates are higher among women than men. So this increase in the number of women and girls becoming infected in HIV and AIDS is due to the fact that the mucous membrane of the girl, especially on their cervix, so these are vulnerable to sexually transmitted diseases. That's why male to female HIV transmissions are more likely than female to male transmissions. So most of the respondents on this kind of research involving HIV or AIDS are mostly the women of our society. So another good example involving women and research are those forced into prostitution or the what we call the transactional sex. Okay, so why in many bars we often see women? So is this considered an economic necessity in their part in order to provide for their families, or maybe it is a survival strategy, especially if they do not have other options. So from these examples, women are the target participants. So they may sometimes need confidentiality due to their situation, and that's why they are considered to be under vulnerable populations. Okay. So another vulnerable population are the pregnant women. Okay. So pregnant women should be awarded special protection because of additional health concerns during pregnancy and the risk of damage to the fetus. So one factors why pregnant women are exposed to higher risk is due also to lack of scientific knowledge. So it is true that when a mother do not have an adequate information on the use of therapeutic agents during their pregnancy, so it is impossible to make an informed consent or informed decision about the risk or the benefits of participating into research. So there may be a potential harm in both from the mother and on the fetus. So pregnant women must be excluded from research unless the purpose is to meet the health needs of the mother, and the fetus will be placed at risk only to the minimum extent necessary to meet such needs, or the risk to the fetus is minimal. So drug research using pregnant women as subjects is governed by the federal regulations. So in accordance to federal regulations, no pregnant woman may be involved as a subject in a human clinical research project unless, first, the purpose of the activity is to meet the health needs of the mother, and the fetus will be placed at risk only to the minimum extent necessary to meet such needs, or the risk to the fetus is minimal. However, if a woman gave her consent to be included in the research, how about the consent of the father? So research involving pregnant women is permitted only if the mother and the father are legally competent and both have given their consent after having been fully informed regarding the possible impact on the fetus, except that the father's consent need not to be secured if, first, the purpose of the activity is to meet the health needs of the mother. Second, his identity or whereabouts cannot be reasonably ascertained. Third, he is not reasonably available, or the pregnancy resulted is from rape. Okay. The third one are the children. So involving children in research raises serious ethical concerns. So the major ethical issue for involving children is that parents are the primary decision makers for their minor children. So children are considered vulnerable population because they lack the autonomy and decision-making capacity to consent to research ethically and legally. Okay, so as well as to understand and accept the risk and benefit of that research. So they have this limited intellectual and emotional capacities, and they lack the legal capacity to provide a valid informed consent as compared to adults. Okay, so however, restricting children's participation in research is not appropriate because their participation is necessary to develop new treatments and prevention methods that will benefit the children. So children, though they are legally unable to give their valid consent, but they may possess the ability to assent or dissent from participation. So out of respect to these children as developing persons, children should be asked whether they wish to participate in that research. Okay? So it is important for researchers to acquire the assent of children to the extent possible, as well as the informed consent and permission of their parents. So in general, parents or guardian, their permission should be sought before seeking the assent of a child, particularly in more than minimal risk research. And of course, this means the child must also actively show his or her willingness to participate in that research. Okay, so these are the permitted categories for research with children or involving children. It depends on two things. First, do the investigational procedures involve greater than minimal risk to the child? The second is there a prospect of direct benefit to the child? Okay, so the permission of one parent is sufficient for a study that involves no more than minimal risk or that involves greater than minimal risk but could benefit the child. And for other categories of research, both parents need to give permission unless one parent is deceased, incarcerated, or not reasonably available, or when only one parent has legal custody of the child. Okay? So there must also be no undue inducement to participate for parent, guardian, or child. So undue inducement could happen in research involving human subjects if prospective participants are strongly motivated by financial incentives. So, or there is amount of money to be offered. Okay, so participants might make poor choices because money has overpowered their decisions. However, a small gift to the child after completion of the research is still acceptable, and refusal to participate or continue in the research should also be respected. Fourth, vulnerable population are the mentally ill or the mentally handicapped person. Okay, so in the case of person with mental disability, special provision and treatment may need to be need to be made, especially when their comprehension is very limited. Okay, so for these persons, as respect, so it requires giving them the opportunity to choose to the extent they are able, whether or not they want to participate in research. So we are going to ask this question. So are they capable of self-determination? Okay. So respect for the immature and the incapacitated may require protecting them as they mature or while they are incapacitated. So it is usually that informed consent will be provided by a surrogate or legal representative of that person. So adults or persons with mental disabilities are frequently used as research subjects in studies such as some mental illness or developmental disabilities, in dementia, or in other conditions associated with mental impairment. Okay, so but we have here the golden rule for involving mentally ill or handicapped people. So we have the objections of these subjects to involvement should be honored unless the research entails providing them a therapy unavailable elsewhere. So as long as the research helps them to be treated, so it would be a great advantage on their part. The fifth one are the elderly. Okay, so the elderly are not an inherently vulnerable population. However, their vulnerability is context specific, as they may be vulnerable due to age, due to health, due to functional status, chronic illness, and financial circumstances, according to Agency for Healthcare Policy and Research and the NBAC. Okay, so old age does not necessarily prevent a person from consenting to medical research. So elderly patients are generally assumed to be competent to consent to research. No, so unlike children, they have the capacity to decide on themselves. Okay, so however, consideration should be given to the possibility of mental deterioration, the ability to comprehend, and the dependence and vulnerability of the elderly once they are involved in that research. Sixth are the prisoners. Okay, so prisoners, individuals involuntarily confined or detained in a penal institution, so they are considered vulnerable because the constraints of incarceration may affect an individual's ability to give voluntary informed consent. Okay? So, since prisoners are confined in a restricted place, okay, so limited activities are only done in the jail, and they may get, because of that, they have limited economic power, inadequate protection of human rights, limited availability of health care and treatment options. So from these causes, they may somehow get stressed, they're being crowded, they are psychologically devastated with symptoms such as psychosis or severe depression and complete social withdrawal. Okay, so they really need additional attention and protection once they are involved in research. And of course, prisoners must also be informed, usually in the consent document, that their choice of whether or not to participate in the study will have no effect on parole decisions. They will not receive any special advantages in the prison for participating. Declining participation will have no effect on any current or future disciplinary actions in the prison. And confidentiality in the prison setting is limited. And any effect this may have, that is any requirements to report imminent threats of harm that prison officials may overhear responses, and etc. Okay? And the last one are the educationally or economically disadvantaged person. So, educationally disadvantaged participants may not fully comprehend the concept presented by the research, and the researchers must take extra precautions to ensure that the participants fully comprehend what is expected of them. So similarly, economically disadvantaged participants may be easily persuaded to participate in research if the economic compensation is so great that the participant ignores or disregards the research risk as a result of the income provided by the study. And these are also the other vulnerable populations that may be involved in research. So the residents of a facility, such as mental health facility, nursing home, treatment center, etc. These are also the individuals with a life-threatening illnesses or conditions such as cancer or HIV or AIDS. They are victims of traumatic events like abuse and natural disasters. These are individuals involved in a crisis such as war, natural disasters, individuals who are not fluent in the language the study is being conducted. Say, for example, the non-English speakers and the subordinates of the research, such as the students and employees. So aside from the 7 vulnerable populations that were discussed, these are also the other vulnerable populations that we might include as our target participants in our research. So for the conclusion, the use of the term vulnerable in the context of human research protection does not refer to susceptibility of harm, but rather the inability or a threat to the ability of an individual to give voluntary informed consent. And vulnerability is considered to offer better protection, not to stop research on the vulnerable. Okay? So vulnerable groups' rights should not be denied to participate in relevant research, and vulnerable subjects should be included, but also they deserve special protection. So think carefully about the population that we plan to include in our research and take the steps to ensure that their rights and their welfare are protected. So these are the references that we use in this presentation. So Mr. Joshua L. Nieves and yours truly, Apple J.D. Cagayan, would like to thank you for actively and attentively listening to our discussion. So thank you again and have a nice day.